Hi, Dr. Kevin Windisch from Sparks Pediatric and Adolescent Medicine. Welcome to our video series for parents. Sorry I haven't checked in a long time. Things have been kind of crazy here in the office. Please remember that these videos are not intended to replace visits to your physician. They're here for your education and hopefully to help demystify some medical things for you. Today what we want to talk about is a disorder known as Hirschprungs disease. Now, Hirschprung's disease is reasonably rare in the grand scheme of things, but it is something we run across from time to time. It's present at birth, but the symptoms may not really show up until the kids are a little bit older, and it results in severe long-standing constipation. It can get so bad that the intestine actually stretches out and becomes infected. We refer to that as toxic megacolon, and it does need to be treated surgically. What happens for the kids who have this is that the nerves that run to the intestine don't form. These are known as ganglion cells, and usually it's just a small segment within the intestine, 1 or 2 centimeters in the large intestine. But that segment then constricts and it's not a true scar, but it's vaguely think of it as a scar. And with this constricted scar-like area, the stool has a hard time passing past that, and so the kids back up. Treatment is by removing the aganglionic segment surgically, and usually the kids do very well after that. There are a handful of kids that can go on to have some ongoing problems afterwards, but for most patients, removing the segment solves the problem. This disorder is reasonably rare. It is something we keep in the back of our mind with all patients who present with constipation, but the reality is if the constipation wasn't a problem until the child was 5-6 months of age, then it's probably not Hirschprung's disease. We can get the first hint of a diagnosis from physical exam if we feel a dilated colon, or with an unprepared barium enema. And the key here is that this enema is unprepped, meaning we don't give the child laxatives prior to the enema. That's important to recognize. If your doctor goes to order a barium enema, he'll want it as unprepped. And the better children's hospitals know to do it as unprepped, but some of the smaller hospitals that are kind of general hospitals taking care of mostly adults will try to get the parents to prep, and it's important that you say, no, this needs to be an unprepped BE. The parents can then go in, they get the barium enema, and we see the constricted zone, known as the zone of restriction, and that'll give us a hint that there's a problem, and it'll tell us how far into the colon it is. A gastroenterologist or a surgeon can then do a biopsy, and they'll look for ganglion cells, and if they're not there, we have the diagnosis and it can be fixed. There are some other diseases that mimic this, something called chronic intestinal pseudoobstruction, also known as megacystis microcolon, which is exceptionally rare. It involves bladder function as well. In those patients' cases, there are ganglion cells present on biopsy, though. This is not something that can be treated medically. It does need to be treated surgically, unfortunately, but the good news is kids do generally pretty well with the surgery. If you do any reading on this, you'll read that there's an association between Hirschprung's disease and Down syndrome. The reality is most patients with Hirschprung's do not have Down syndrome, so the presence of Hirschprung's doesn't necessarily make us concerned that there's a chromosomal problem for the child. So I hope that this helps to demystify this a little bit for you and help you to understand a little bit about what's going on with your child if somebody has mentioned that maybe he has Hirschprung's or she has Hirschprung's, or maybe a diagnosis has been made. And hopefully in the hands of a skilled pediatric surgeon, you can get the relief that you need, and what's been a long ongoing issue with a lot of discomfort for your child can cease to be a problem. If we can be of any assistance here, give us a call at 775-359-7111. Please remember, we can't help you over the internet or telephone. We need to see you in our office. We'll see you next time.